And for more on this and what the future of the war on drugs might look like, we welcome in Stanford Psychiatry and Behavioral Sciences Professor Keith Humphreys, who served as a drug policy advisor to the George W. Bush and the Obama administrations. Good morning, Professor. Thank you for joining us.
Good morning.
How did we get here? How did fentanyl take over as the big opioid problem drug after OxyContin and others before it?
Well, fentanyl was really driven by the supply side more than the user side. It's not that people demanded it. It's that it is synthetic. It does not require agriculture. It does not require long supply lines. So the profit margin for traffickers is much higher. And that's why they went into it. And they're not going to leave it because it's extremely lucrative for them. As brutal as that sounds, they really only care about money.
Well, I mentioned the war on drugs, and that is such a heavily freighted term, but we are at war against fentanyl and against the overdose deaths. But I heard a comedian mention that there was a war on drugs in the 90s and the drugs won. And that was a joke. But what did we learn from that war on drugs that might help us going forward with this one?
Well, one thing we do know is that, prohibiting the production and the marketing, such as we have with tobacco and alcohol, actually does dramatically reduce the number of people who use it. We have more people dying every day from alcohol and tobacco, which are legal, than we do for all illegal drugs combined. But we also know that you can't completely eliminate supply. I mean, the work that DEA does is very important. That reduces supply, but in the end, there will be some drugs available. And that's why prevention and demand reduction, meaning, helping people get into treatment and get into recovery who have a problem already, is always going to be a critical part of responding to drugs in the United States.
And we've got $42.5 billion in place to implement drug control strategies from this administration. Is that going to be money well spent, or are we looking at more of a problem and wasted money there?
But it's absolutely important to spend money on people who are addicted. And just put it in context, we have a healthcare system that spends $3.5 trillion. So we don't actually spend that much relatively on addiction. But it's definitely like other chronic illnesses. Addiction does require resources in the healthcare system, and we're going to have to provide those. And the administration and Congress has done a lot of that, but we have a new Congress coming in, and they're going to have to be committed to that as well. Many of them are hearing from the constituents about the destruction in those communities, and I'm very hopeful that they will be responsive to that.
All right, Professor Keith Humphreys from Stanford, thank you very much for joining us.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.